a simple blood test that we call the serum PSA, or just PSA for short. You can walk into any lab or any hospital and request for it to have it done. Okay, when it's done, you get to evaluate so that you get an idea of where your prostate levels are. Okay, and this guides you. Sometimes it can be high a bit if you have an infection or some inflammatory process going on with the prostate, but most of the time it's normal and then you'll be fine. When it's very, very high, that's when we'll do the sticking of a hand in the bum to make sure it's not too hard and all those things. So we do our further checks and all. But usually when we use the blood, we're able to pick up, or even the scans. We can also see the states of the prostate gland by doing a simple ultrasound scan. So men don't like going to the hospital. I mean, you can do a PSA once a year. And I'd encourage men that are over 40 years to do this. Okay, when you are younger than 40, I mean, the chance of you having prostate cancer is a bit, it's very, very slim. Okay, so once you cross the 40 years, that 40-year age, I'd encourage you to do the screening every year. And if it's in your family too, they have to do the scan in addition as well, just to see the prostate and whether it's normal or not, or whether it's enlarged or not. So what is the prostate? A lot of people are probably, you may know, if you're a man, I think you should know what a prostate is, but I assume you don't know. And I'll tell you a little bit about the prostate. So the prostate, it's in the pelvic region for the men, if I can say it like that, right? And it produces fluids that when the man ejaculates, some of those fluids come out. Okay, so that's the main function of the prostate. And how do you know that you have prostate? Usually when it gets enlarged, the man will have difficulty in urinating. So he can be urinating and it's coming in bits, or he may not even be able to urinate at all. That we call urinary retention. So he wants to pee, but he can't pee, simply because the urethra, or the passage in which the urine passes through, the prostate gland is just around it. So when the prostate gland enlarges, it's like squeezing on the urethra, so pee cannot flow the way it should. So it's a very small gland, but it has an important function in the body. When you have a problem with the prostate as well, you're able to have proper or sustained erections as well. So you have men complaining about that. So besides the urinary difficulties, you may have problems with ejaculations as well. So those are the main symptoms that you see. And a lot of people assume that, oh, it's only old men that have urinary problems and all that. But assuming you had checked, or you have been checking your PSA over the years, you'd pick it up early, and then if it's even enlarging a bit, you can give medication that will make it shrink so that it doesn't get too big. So you don't have to wait until you're now 60, 70, and you go and check, and now it's cancelled or something. You get it. So regular checkups for the PSA and then the ultrasound scans are very, very important in avoiding or preventing prostate cancer. And if you have a family history, so your dad had it, or an uncle had it, or a grandfather had it, you have to be extra alert and know that you have to be checking for your PSA on a regular basis. Okay, so that's it for the men. If you have any questions, feel free to comment under the post. I'll come and answer the questions for you. Like, share, and subscribe my YouTube channel, Dr. Ajwa. Thank you.